Welcome to this explainer, where we're diving straight into how international patients can lock down world-class clarity through a second medical opinion right here in Germany. When you or a loved one are staring down a major health challenge, that uncertainty, it's totally overwhelming. But imagine having your medical file audited by elite specialists in German academic medicine, literally before you even pack a bag or leave your home country. Today, we're unpacking the exact process Euromedical expertise uses to flip medical uncertainty into absolute confidence. Let's get into it. So here is our roadmap for today. We're going to cover 1. What a second opinion actually is, 2. Who needs this service, 3. The necessary medical documents, 4. The 5-step coordination process, and 5. The physician-led difference. Section 1. What is a second opinion? Establishing clarity in German academic medicine. The absolute most crucial thing to understand right out of the gate is that a second opinion is there to support, not replace, your treating provider. I hear it all the time. People hesitate, right? They think asking for another perspective is kind of like a slap in the face to their local doctor. But honestly, nothing could be further from the truth. Seeking this independent review is a super responsible, totally normal part of modern healthcare. In fact, elite hospitals globally actually encourage it. A proper second opinion is basically getting a fresh, highly specialized set of eyes on your imaging, your pathology, and your proposed treatment plan. It ensures you have 100% clarity before you commit to a life-changing decision. Section 2. Who needs this service? Identifying the beneficiaries. So who actually benefits the most from this kind of expert intervention? Well, the key is not waiting until it's an absolute emergency. The sweet spot, right after a diagnosis is confirmed or the moment a major surgery is proposed. If your treatment options feel muddy or you're getting conflicting advice, consider that a massive red flag that you need a second opinion, for sure. We see international patients, especially from the US and GCC countries like Saudi Arabia, the UAE, and Qatar, frequently seeking this clarity before they dive into really high-stakes treatments in oncology, cardiology, or neurosurgery. And for incredibly complex situations, like tough cancer cases, this review can even bring in a multidisciplinary tumor board, where a whole team of top-tier experts collaborate to map out your absolute best pathway forward. Section 3. Necessary medical documents. Preparing for a precise assessment. Okay, so to make this happen, what do you actually need? Getting these specific records together is what allows the experts to thoroughly assess your case remotely before anyone starts booking flights. You're going to want to pull together your recent medical reports and discharge summaries, and this is absolutely critical, your imaging studies. We're talking MRIs, CTs, PET scans, X-rays, the whole shebang. Throw in your pathology and lab reports, plus a summary of any treatments you've already had. Think of it like you're building this high-definition puzzle of your health. By compiling all this and adding just a short description of your current concern, you're handing the reviewing specialist in Germany the exact foundation they need to evaluate your case inside and out. It puts the power back in your hands, letting you make informed choices without unnecessarily rushing onto an airplane. Section 4. The 5-step coordination process. Your pathway to medical clarity. Let's walk through how this actually works in practice. It's a really seamless journey. Step 1 is the medical file review, where your submitted records and imaging are clinically evaluated. Once they've got a solid grip on the medical reality of your case, we move to Step 2, precision matching with the exact right specialist or hospital in Germany or Switzerland. And listen, only after a suitable specialist confirms they can take the case do we hit Step 3, which is requesting a hospital estimate. This is huge because it means your costs are based on a real clinical assessment, not just blind guesswork. Now, if you decide to travel for care, Step 4 kicks in. That's comprehensive travel, accommodation, and multilingual family support. English, Arabic, German, French, you name it. Finally, Step 5 is ongoing follow-up and advocacy with your treating provider back home, even long after your consultation. It's a complete, end-to-end ecosystem. Section 5. The physician-led difference. Why clinical authority matters. Now we have to talk about what makes this completely different from your standard medical tourism agency. Standard booking agencies are usually super administrative. They're basically middlemen. They just translate your files and hand your life-altering medical case over to non-medical case managers. But physician-led coordination, total game changer. In this model, every single medical file goes through a strict clinical audit. Because a real doctor is leading the coordination, they actually have a deep subspecialty understanding of your specific pathology. They aren't just blasting your file out to a random hospital inbox. They are precision matching your exact clinical needs with specific academic research chairs and elite specialists across Germany. It is literally the difference between filing administrative paperwork and leveraging true clinical authority. And this physician-led model is spearheaded personally by Dr. Med Hind Holly. She is a German-licensed, board-certified specialist, so her expertise isn't just theory or paperwork. She has direct, residency-level training inside elite German university hospitals. That means she has firsthand mastery of how multidisciplinary tumor boards work, and she knows exactly how German academic hospital hierarchies function from the inside out. When Dr. Hind reviews your file, she's looking at it through the lens of a highly trained clinical specialist. She knows exactly which of her peers in Germany is best equipped to handle your specific, unique medical challenge. I want you to take a second and really absorb this quote from the source material. Having an experienced physician review the full picture, including imaging, pathology, and any prior treatment, can help patients feel more confident that no reasonable alternative has been overlooked. I mean, that hits the nail on the head, right? That is the ultimate goal of everything we've talked about today. Patients constantly tell us that the waiting period before getting a second opinion is the most agonizingly uncertain part of their entire medical journey. This structured physician-led review, it's not about second-guessing your hometown doctor. It's about handing you a completely illuminated, deeply informed basis for the choices you have to make. It's about giving you ultimate peace of mind. We've covered a ton of ground in this explainer today, from breaking down the truly supportive nature of a second opinion, to the exact documents you need, that rigorous 5-step process, and the massive advantage of having a board-certified specialist like Dr. Hind Halali clinically audit your pathway. So I'm going to leave you with one final thought to chew on. When you or a loved one are facing a complex, life-altering diagnosis, will you settle for the stress of uncertainty, or will you choose the clinical authority and absolute reassurance of physician-led coordination?